are those little pieces coming off?
Maxillary.
Maxillary. Okay, and then what's the other branch off the common carotid?
Internal.
Internal carotid.
Wouldn't those technically like be, I guess, twisted in to go into the brain?
Yes. Remember, this is a drawing where we have to flatten things out. And so what we've done is taken things that are more dorsal and then put them out here.
Oh,
Yeah, so that's why they're out to the side.
technically they would go back.
Yes, they would be going back in here. Yeah? Who's in the morning? Who's in the morning lecture? Oh, okay. What are these?
Lymph nodes? No.
They're blood. They're made out of like a blood vessel.
There were there like the right venous angle or something like that?
No, it's an arterial thing.
It's like
Does it look like it's the
artery.
same size? So what does it look like? It's bigger, right? So this swelling right here at the beginning of the internal carotid,
I have a question. You can answer it later if you want. But why is the ductus arteriosus still patent in the fetus?
because the fetus is not breathing air, right? So for lecture 7, we're gonna talk about this. The fetus is not breathing air, and so it's getting all of its oxygen, not from the lungs, but it's getting its oxygen from the placenta, from the mother. And so what happens is the oxygen-rich blood comes into the heart, and it's already oxygen-rich when it first enters the heart through the inferior
Okay,
vena
so it
cava.
doesn't need to go to the lungs to get oxygenated?
So sending the blood to the lungs to get oxygenated is actually wasting like the time and the energy required to do that. And the lungs are actually really small and deflated anyway, right? What
Is
is
it a sinus? The
Carotid sinus.
carotid sinus.
So, aren't sending the blood to the lungs to get oxygen, so what this does is, the blood that would normally be going through the pulmonary trunk and going to the lungs, you wanna just use that blood and send it out to the body. So it bypasses and it goes straight into the aorta. That's what the ductus arteriosus is for. But you don't need that when you're an adult, right? So this closes off. So it pinches off and it just becomes a tiny, tiny little thing. And it's closed off, so it's not a duct anymore, right? All right, so now, right, we talked about the first branch and all these, so what's the second branch off the arch of the aorta?
Left subclavian.
Second branch.
Left common carotid.
Left common carotid. So when we look at here, what is this?
Common carotid.
Left common carotid. What's the third branch off of the arch of the aorta?
Left
So
subclavian.
here's the third branch, there's your left subclavian. Right? So this is after everything's shortened and it's all kind of come together now. Okay.
Why does it shorten? Does it just happen that way, or is there a reason why it shortens?
Okay, so. It's not actually shortening.
Oh,
See this right here?
yeah.
Let's say this is a vessel inside of the fetus. Okay? So this is the vessel inside of the fetus. And let's say the fetus is about this big. Yeah? So at some point, all of you, all of us, were about this size. What happened?
We grew.
Bigger?
Yeah. So watch this.
It
Does
just.
this grow?
No.
So if this doesn't grow,
Oh.
together with the rest of everything, what happens?
Just stays.
It looks smaller.
Looks like it's getting shorter. That's really what's happening.
Oh,
I say that it's getting shorter because it's easier to say that. rather than explain that it's staying the same size while everything else gets bigger. But that's really what's happening. Is the vessels, when you look at this right here, that right there, it just doesn't get bigger. It stays the same size. And then what happens is your arm is just growing and growing and growing, and your heart is moving down, and everything else is growing, but that just stays the same, and so relatively it looks like it's shrinking. That's it, that's all it is, right? Yeah. So, I mean, that's what happens, is you just don't devote resources towards making it grow longer. And then it looks like it's getting shorter, yeah? All right, now, first branch, second branch, third branch, right? And what do we have right here? What's this? Vagus. And what's this right here? And what is the right recurrent laryngeal hooking around? Hooking around the right subclavian. So, yeah, in the fetus and in the adult, it's hooking around the right subclavian. What's this right here? That's also vagus. What's this?
Left recurrent laryngeal.
Ligament.
And then the left recurrent laryngeal in the adult. Okay, so in the fetus, what was it hooking around?
Ductus arteriosus.
But when you are born, now your lungs expand, you're no longer relying on the placenta, so your lungs are fully functional, so you no longer need to send blood from your pulmonary trunk to your aorta. So this closes off, and what does that now become?
Ligamentum arteriosus.
Arteriosus.
Does that make sense? This is something right here, ductus arteriosus changing to ligamentum arteriosum, that I guarantee you is coming up again. So you should start studying it now and learn it for, a week from today, right? Your exam you're gonna have a week from today. But it's gonna come up again. So don't just learn it and then just dump that information and go, oh, all done, don't have to worry about it. I promise you have to worry about it again for your second midterm. Was that what you were
Yeah,
asking
well,
about?
I was just kind of confused about the first one, but yeah,
Does this
that helped.
make more sense with the first one?
Yeah, it's,
First one's okay now?
yeah, it's okay.
Alright.
Does the suffix sus and sum, does that mean anything? Like arteriosus and then
Oh.
arteriosum?
Yeah, it's a Latin thing, and I'm not like well versed enough in Latin to tell you exactly why they. But you have to match like essentially like gender, and you have to match number, right? So the idea is because we're talking about right like ductus, right? You have to match the endings. So ductus, you have to match it so it's arteriosus. For ligamentum, you have to match it so it's arteriosum. Yeah, it's the same thing is when we're talking about, which we will talk about, foramen ovale, okay? Not for your head, there's a foramen ovale in the heart. You have to match that. So the foramen is ovale, but when it changes and it closes off, it becomes a fossa. So you have to match the gender and everything. So for foramen, it's foramen ovale. For fossa, it's fossa ovalis. And that's why, is because Latin is weird that way, you have to match genders. So, right? Like it would be like a bag, right? Like if I were describing the bag, I would have to match the gender of the bag when I described it, right? So if I add an adjective to it, right? Let's just say that bag was female, right? And let's say, what's something else? Something else in the room. Book, that book was male, right? So this is a blue book, right? Because it's got a blue cover on it, and that's pink. So let's just say it's red, right? So if you were talking about a bag, you would say, you know, bag, rosa, because A is the ending for a female, right? And then, let's see. For blue, I'm trying to remember what the heck was blue. What is it?
Is it an O?
No, I'm trying to remember the word for blue.
Oh. Somewhere.
I can't remember if that's exactly the same for Latin, but let's just say it is. So then, like, you know, book would be, well, book is like, you know, Libris, right? And then you would say, right, Libris, azulis. You have to match the gender. That's why you have to do that, so, right? Oh yeah, bag is like bosa, right? So it'd be bosa, rosa. And it would be Libris, azulis. So you have to match gender. That's why that happens. Yeah? Okay, so better with the arches? Does that make any more sense? Yeah? No? You, right? If you draw the arches and you're following them out, right? Don't forget, you're gonna wanna tie this to your vasculature stuff, right? So the adult version of the vasculature, so remember what we talked about, when you look at the arch going from the right to the left, as you're going through this and thinking of development, also think about, right, the fact that it's curving from the right to the left, so it should make sense, right? We talked about this, should make sense. Right side is first, so you want to supply the things that are on the right first. And isn't your arm lower than your head and your neck? So when you're doing the brachiocephalic, what should come first? The right arm, and then what comes next? The right side of the head and neck, and then what comes next? Left side of the head and neck, and then what comes next? The left arm. So that's why brachiocephalic with right subclavian, right common carotid, then your left common carotid, then your left subclavian, because you're following the path of the vessel and the flow of the blood.
Is it aorta?
Yes.
Just going right to left?
Same thing when we do the guts, right? Is you're just following what's coming first and then coming next. Yeah?
I
Yes?
know,
No? Yeah.
I know it's sort of off topic, but you know you said like it goes first to the right side. Is that why when you're gonna get a heart attack, you like this, like the right side gets numb or something?
Oh, like, let's see, this is the tricky thing, is, it's not the flow of the blood that we're dealing with right there, is when people have a heart attack and they feel numbness in their arm, the painful feeling is the innervation, right? And so what it is, it's called referred pain. And so, when people have like gut problems, they won't actually feel it where it's happening. Is they feel it in a slightly different location because that's where the nerves originally came from. So same thing with your heart, is when you're having a heart attack, it's very difficult for people to truly feel with their organs where the pain is occurring, okay? So what happens is, the path of the nerve that it originally came from, that's what kind of confuses the signal, and you'll feel the pain in a slightly different location, right? So it's not necessarily that, you know, it could be that you have a heart attack and now you're not able to properly supply your right arm, so your right arm feels a little, you know, numb or something. But when